major development in veterinary education is taking shape right here in New Jersey with October's launch of the Schreiber School of Veterinary Medicine. The Rowan University School in Harrison Township is training the next generation of veterinarians while also expanding access to high quality animal care for the surrounding community. Dr. Matthew Edson is Dean of the school. He joins us this morning. We say good morning to you, Dr. Edson.
Good morning. Thanks for having me.
You bet. Nice to have you on. And so, talk about what's different about the school. Is this the first school of veterinary medicine in New Jersey?
Very first, this is the first time we've had access to vet education within the Garden State.
That's unbelievable to think about the most densely populated state surrounded by the first largest market, New York, and the fourth largest market, Philadelphia, and we never had a veterinary school. That's mind-boggling.
We haven't, and all of us that were Jersey residents growing up had to leave the state to go to school. We average about 300 New Jersey residents a year that want this vet education, so there's definitely a need.
And what a great location and what a great thing to have. And Schreiber is, of course, a teaching hospital. So what does that mean for area residents and pet owners?
Yeah, that means not just our students have access to the education here, but everyone in our area has access to veterinary care that they may not have been able to access before. That's not only the primary care like you'd have for your cat or dog for wellness and vaccines, but also for care for large animals like horses and goats and sheep. We have a service covering all of the southern part of New Jersey, as well as a hospital with specialty care like cardiology and oncology. Radiation imaging, radiation oncology is not something we offer here, but diagnostic imaging like X-ray, CT, MRI, care for exotic animals, anything that you could possibly imagine you need for your pet, we now have here right in Harrison Township.
I'm amazed by the different specialties in veterinary medicine that I'm seeing. I live half between South Florida and New Jersey, half and half. And in South Florida, especially, I see there's a clinic that is a dental clinic it's a veterinary dental clinic. And that to me is a specialty I had never seen before. Is that relatively new to see something like that?
We have specialties just like we do in human medicine. And I was talking to somebody yesterday saying animals have eyes too. We have ophthalmologists for that
Yeah.
reason. Dental disease is a really big problem in our pets. We brush our teeth once or twice a day. Our pets don't do that. So we have an entire dental program here, not just for routine dentistry, but all the way up to oral surgery, an entire suite of our hospital dedicated just to that program.
If I had two Pomeranians, unfortunately, they passed on already, but uh, those little dogs tend to get a lot of grime in the back of their teeth. My pets, as sweet as they are, would not let me near their teeth. And so it would always end up being the annual or every other year, the knock them out and let the dentist scrape the plaque off those teeth. But that's not the way, right? There's got to be a better way. So hopefully, you could teach stupid people like me how to properly brush the teeth of their little dogs. So why should a prospective veterinary student halfway across the country want to come to New Jersey for this particular veterinary school? This is offering a lot, as you're mentioning, of the specialties that maybe some of the older schools are not.
Many of the schools do have teaching hospitals. Some of the newer programs actually do distributive education where there's not an on-campus hospital. We felt that it was important here to have a hospital on campus that we could use for teaching of our students, but also knowing that there was a need for those services in the southern part of the state. So there was a couple pieces to the calculus of that. I think our program, really one of our major focuses is we want these students to feel like they are prepared to enter practice at the time they leave our program and feel like they got what they paid for in their education by having that level of preparation. So we're very big on hands-on training, clinical skills from the very first day, and teaching these students not just the book knowledge, but the actual practical and professional skills to be able to do this job when they leave us here.
How many students do you have right now in your program?
Our very first class of 75 students just finished their first semester. They're coming back from their Christmas break on Monday. So they'll be coming back for the second half of their first year this coming Monday. And we're already in the midst of applications for our second class, which will enter next fall.
I love that. And they're the very first, they'll be the first graduating class ever. And that's fantastic. How exciting is that? Um, and
So
then do they go into other, like, do they do clinicals and rounds and whatnot at other veterinarians before they get their license? Is that how it works in veterinary medicine?
They may. Our program is really structured where the first year teaches them all the normals, the second year teaches them all the abnormals, the third is how to make the abnormals normal again, and then we do about 13 months of clinical training within our hospitals here, within our field services, whether that be for large animal shelter medicine, and to some degree, some outside training at other clinics. After that, they're eligible to sit for a licensing exam and become licensed in any of the 50 states. Some of them then go on to postgraduate training if they want to be a specialist. So a student who wants to be a radiologist or a surgeon will often go to 3 or 4 more years of training after school. Those that are going to general practice typically enter general practice after graduation.
Dr. Edson, do they ever end up studying some of that, like radiology? Do they go to a human medical school ever to study that? Because I'm assuming the science behind it is it's pretty much the same, right?
We don't have required rotations in any of the human medical schools, but we do here at Rowan have both an osteopathic and allopathic or DO and MD program. And we're very big on One Health here and getting these students in all of these programs together to understand the strengths of all of our professions. So they certainly have opportunity to interact with those on the human medical side, whether it's in that setting or in research, but it's not a required part of our curriculum.
No, that's fascinating, and how it all comes together eventually. Just an amazing thing. I love veterinary medicine, and I have an awe for veterinarians because people forget when you're a veterinarian, you don't just treat dogs and cats, you treat any animal, right? So you need to know the biology of a zillion different species, whereas doctors for humans only have to worry about one. So there's a lot of study there, a lot of serious research you all have to do. The website for you folks, what is your website, Doctor?
It's SVM, as in School of Veterinary Medicine, .rowan.edu.
The Schreiber School of Veterinary Medicine, if I could say it, veterinary medicine in Harrison Township, part of Rowan University, now open and training the next generation of veterinarians. Dr. Matthew Edson, the school's dean, thank you for coming on this morning. Good luck to that first
Thank you very
class.
much. Thank you.